Yes, my name is Dr. Hassan. I will be a team leader, and so we're going to receive one patient. So can you introduce yourself for me, please?
I'm Sarah. I'm an ATLS nurse.
Nice to meet you, Sarah.
I am Satya. I am also ATLS nurse.
Okay, so we're going to receive one patient, trauma victim with disrupted vitals. So we need to prepare ourselves. I will assign the rules for you. Sarah, please, I need you to take care of the airway. Once patient is coming, connect him to the cardiac monitoring. And Hadi, I need you please to take care of the fluids. Okay, so we need to insert 2 IV lines and give medication by my order. So meanwhile, I need to bring your airway truly. You have to bring the stylet and the intubating tube and the airway adjunct, oropharyngeal and nasopharyngeal, and you should prepare warm fluids and cold fluids and activate the trauma team, and let's wear our personal protective equipment, right? So when the patient is arriving, let's prepare ourselves. Let's wear our personal protective equipment.
Patient arrived.
Patient arrived. So
Trauma port activated and IV fluids and IV cannulas are prepared.
hello, sir.
Hi.
Hello, how are you? My name is Dr. Hassan. I'm going to take care of you.
Thank you, doctor.
Listen to for breathing. Any strider?
There is no strider,
No hoarseness of voice.
no hoarseness.
Okay, please, can you open your mouth for me, please? Any foreign body inside? Any
No.
secretions?
No.
Okay, right. Sarah, please, could you apply the neck collar for me, please?
I cannot.
You cannot. Can you slide your hands over mine, please?
Of course.
Okay, maintain inline mobilization. So we're going to apply the neck collar. We're going to measure the
Applied.
size.
Neck collar applied.
Neck collar applied. Good.
Okay.
Okay, good. Please, Sadia, could you apply head blocks for the patient and triple immobilization?
All right.
Done?
Head blocks applied.
Okay.
And 3
Please,
mobilization
Sarah, I need you to apply 15 liter oxygen via another breathing mask. Okay. So let's go for breathing. I'm going to expose the chest. By exposure, I can see anything.
Oxygen mask attached.
Thank you, sir.
No
Yes.
obvious injuries.
Right. No obvious injuries. Right. What's the saturation level?
Yeah.
SpO2.
SpO2 is 86.
Okay. So our patient is quite desaturated and the RR is still 30s.
Yeah, 30 minutes.
Right. So I'm going to palpate the trachea.
Trachea central.
Trachea is central. What about GBP?
JBB noticed.
Okay, right. What about the palpation? I can hear any click.
No crackles or criticals.
Okay. Is there any blood in my gloves?
No.
Right. I'm going to percuss.
Hyperresonant. Resonant. Hyperresonant. Resonant.
Okay. So this patient having hyperresonancy in the right side of the chest. That means we are going to expect something, some trauma in the right side. I'm going to auscultate.
No air injury.
Okay.
Normal air injury. No air injury. Normal.
Heart sound.
Heart sound present.
Okay, so this patient is having mostly tension pneumothorax, there is no air entry. So at this level, we need to decompress the chest wall. So we need to insert cannula in the fifth intercostal space, followed by chest tube. So I need you to prepare the intercostal tube. So this is the cannula. We're going to insert it. Meanwhile, please call for the chest X-ray and pelvic X-ray and EFAS. Okay. So now we can hear the hiss of air. So that means tension pneumothorax was decompressed, followed by chest tube and the fifth intercostal space mid axillary line. Done. Okay. What's the parameters now?
Still the blood pressure 80 over 40.
Okay.
Heart rate is 120.
Okay.
Oxygen saturation is 92%.
Excellent. The saturation is coming up. I need you please to insert 2 IV lines. I need to start the infused fluids. I need to take global safe cross matching and to notify the blood bank that we may need transfusion. Okay, please 1 liter. Consider tranexamic acid. 1 gram to be infused over 10 minutes, followed by 1 gram.
Fluid started and
Okay.
injection transamine also.
Okay, I'm exposing the abdomen. See, an abnormality in the abdomen.
No obvious injuries.
Right, abdomen is
Guarding.
guarding. Right, so this patient might need to have a fast, fast. Okay. So what about the pelvic? Once switching stability
Yeah,
once.
pelvis is no obvious bruises, and
Long bone?
not in the breast. The first exam
Okay.
shows fluid in the Mrcem pouch.
Okay, so this patient having intra-abdominal bleed, let's talk to the GS to come urgently, and I needed to contact the OR. This patient for possible surgery, okay, for laparotomy. What about the long bone? Long bone is patent?
There is active bleeding and open fracture in the left femur.
Okay, so this patient having open fracture, we need to please bring a gauze to cover it. Okay, moist sterile gauze. And this one here, this one, yes.
Still after application, still profuse bleeding.
It's still profuse bleeding. What about the distal pulsation?
Absent.
Absent, there is no distal pulsation. So please, Sarah, could you contact the vascular surgeon because we have critical need now. And so open fracture, it is difficult to apply at almost splint at such level because yes, we'll cover it. We'll try to have a compression please to stop the bleeding. And let's start the transfusion please. 2 packed RBCs to be transfused now, or negative. Meanwhile, we are waiting for the blood from the blood bank. Okay, how is the
Blood
parameters now?
transfusion is on.
Still 80 or 90 over 50 the blood pressure after controlling the bleeding.
Right, so the blood transfusion already started?
Yes.
Okay, theater is ready?
Yes.
Vascular is coming as well,
It's on the
right?
way.
Okay, what about the airways for the patient? Patent?
It is patent.
Okay, breathing is patent?
I'm the general surgery and also covering the vascular surgery at the moment. Yeah.
Hello sir, how are you? I'm Dr. Hassan, I'm a trauma leader. With my team, we received a trauma victim patient, young male, he sustained multiple injuries. When the patient brought, he was desagging, and we found that he having a patient pneumothorax, which decompressed followed by chest tube, and we found that the patient is having open fracture in his right femur.
So please send him to the theater immediately now.
So this
Thank
patient
you.
for theater. Thank you,
Yes.
sir. Thank you, sir.
Thank you.
Thank you.